Well, this is the first time in 90 years this has happened. This has never happened in Social Security history that the commissioner of Social Security now has a part-time job. Well, actually, I guess his part-time job is Social Security. So Frank Bisignano, who was recently confirmed as the commissioner of the Social Security Administration, and he said he was going to make all kinds of different changes and make it better because he's the guy that's in charge to make sure you get the correct check at the correct time. And he said he's going to, do all this different stuff. I've got a little interview where he's going to save Social Security. I guess he thinks he saved Social Security because now the Trump administration decided to go ahead and reassign him. Well, actually didn't reassign him. They said, well, we'll give you another job since Social Security is not that big of a deal. 72 million Americans depend on it. 40% of those, that's basically their only primary income is Social Security, and it's not a big deal. You can do that on the weekends or whatever the case may be. You are now going to be the CEO of the IRS, the Internal Revenue Service. So the same guy that's supposedly in charge of Social Security is now going to be in charge of your IRS. I don't think a lot of people out there have good views of that in terms of privacy and what can be accessed since the same person has everything. And not to mention the fact that, again, this is going to be a side hustle. Social Security is now a side hustle. Are you telling me that there's no one else in the country, hundreds of millions of people that could be put in to the IRS CEO position? This is a brand new position, the CEO. You've still got the commissioner, Besant. He's still going to be the commissioner, but now there's this new position, a CEO of IRS, and the commissioner of Social Security. That's his, I guess, his primary hat now. So there's nobody else in the country could have taken that new position at the IRS. You had to take someone from the Social Security Administration that was supposedly going to be fixing Social Security. It's amazing. So we're going to talk about that today. We've also got a lot of live questions. So if you need any help with Social Security, making sure you get your correct Social Security, retirement benefits, survivor benefits, spouse benefits, disability, Medicare, Medicaid, we'll make sure you type your questions in chat, and we will get to as many as we humanly can within the next hour. There was an interesting story by CBS that kind of outlines this story several times and do kind of what they're telling correctly and what they're telling incorrectly, and add a little bit of my commentary after working at the Social Security Administration for a few decades. So let's watch the video and then we'll discuss it as we see it. All right, let's get everything running here.
However the economic winds are blowing, for some 90 years, Social Security has been a vital financial safety net for older Americans. Now, as David Pogue tells us, many people are wondering just how safe that safety net is.
Social Security recipients are dealing with an unbelievable amount of chaos.
Social Security has been getting a lot of attention lately, and not the good kind.
We paid it in, and now we want to take it out and live with dignity.
The Social Security Administration was already at its smallest size in 50 years when earlier this year, Elon Musk's Doge team cut another 14% of its employees, 7,000 people.
Exactly, and the chainsaw metaphor is appropriate because they just basically took a chainsaw. So if you're gonna, I'm not in charge of a billion-dollar company like these guys, so I guess I'm not as intelligent as these guys. But if you're going to go into an organization and you say, okay, the organization needs to be more efficient, so we're going to make it more efficient, and we're going to provide better customer service and stuff like that. You kind of do that first. You make the systems better. Social Security computer systems definitely need to be updated. Social Security has been complaining to Congress for decades. We need to update the Social Security system. Congress has refused year after year after year after year because they don't want it fixed. They want it broken because it's easier to, obviously privatize when it's broken. So they want to break it as much as possible. But you fix it. And then because you fix it, you make everything more efficient, then you get rid of the employees. That's normally, how it's supposedly done, right? No, they decided to do it the opposite way. They decided to go ahead and get rid of all the employees and then decide, oh, okay, all right, let's see how we can make it more efficient there. So they've, completely opposite of management 101. And the issue with that is now that people are having a hard time getting into Social Security. They're missing their benefits. They're not getting the right benefits because there's not Social Security employees there helping. That's one of the reasons I've come out of retirement, and I've been doing this pretty much live Q&A on a daily basis for quite a few months now. So make sure you type your questions in chat there.
The chainsaw for bureaucracy.
Frank Bisignano is President Trump's new Social Security commissioner. In an interview with CBS Evening News last spring, he insisted that the cuts won't affect people's ability to collect their benefits.
We're bringing a massive technology effort to transform the servicing agenda. We're going to bring AI into the phone system. I intend it to be completed this year.
I'm getting calls now all the time.
Okay, yeah, AI into the phone system, and anybody that's called the Social Security Administration recently, if you've got the AI, it is a hit and miss. I've called a few times just to test it, called about, retirement and working in retirement and overpayments and stuff like that. And it gives you this, this phone hell. You go into here or you listen to the AI message and it just repeats itself and it doesn't allow you to go anywhere. Sometimes it works, but it's just not there yet. And so they're depending, and they're also playing with the numbers. I talked about this in a previous video, that they're saying, hey, the wait times for phone appointments or to getting in on the phone has decreased significantly. Yeah, that's because normally when people used to wait, they have to wait an hour or 2 hours or 3 hours to talk to someone. And it's been around. That's been the problem for quite a while, even before the current administration. But now, so that was a 2 or 3 hour wait. Now you can get in immediately, but you're talking to an AI and people just hang up after 5 minutes and they call again and they call again. And they're saying, wow, we see a spike of people calling Social Security, but the wait times are really down. Yeah, put 2 and 2 together, you can tell exactly what's going on.
From people that can't get through on the telephone, from people that can't get appointments in the field offices. And it will, in some cases, delay benefits. This is a very tough thing for millions of Americans.
Michael Astrew was the commissioner of the Social Security Administration under George W. Bush and Barack Obama. He takes particular issue with something Musk often said about Social Security before he left the government in May. Elon Musk keeps saying that hundreds of millions of dollars are going to illegal immigrants.
He's just lying. And that's one of the most ridiculous things I've heard anyone say in Washington. He's got it exactly backwards. So they pay in, but they don't collect.
In fact, what
Sorry, Michael. You and I have both aged quite a bit. He visited my office several times because we were one of the busiest offices in the country, and so he visited my office several times. Really, really, really nice guy. Yeah, we haven't aged well, have we, Michael? So anyway, but yeah, he is 100% correct. If you say fraud, waste, and abuse or illegal aliens, that's what politics is nowadays. If you use one of those 4 or 5 words, then I guess the American people let you do anything. And so that's what they're doing. Anytime something comes up, the boogeyman is illegal aliens. And then, oh, if that's the case, well, we don't want that. And so you just do whatever you want. So this is what we see with the government shutdown, which is 100% incorrect. I did a video a few weeks ago on all of the steps Social Security takes that prevents people that are not in this country legally from getting Social Security. So it's almost impossible to get Social Security benefits. We're talking retirement benefits, survivor benefits, Medicare, Medicaid, if you're not in this country legally. That is just a fact.
Experts worry about is not fraud, which the agency itself estimates is below 1/100% of payouts. It's the Social Security time bomb.
This Social Security measure gives at least some protection to 30 million of our citizens.
President Franklin Roosevelt created the program in 1935 during the Great Depression as a safety net to help keep Americans out of poverty. The idea was that the government would take a small piece out of every worker's paycheck and pay it to people reaching retirement age. Today, those checks average about $2,000 a month, and they're the primary source of income for 40% of older Americans.
If Social Security were not here, you'd have about 22 million Americans who would be considered poor under the federal standards.
For years, this all
So yeah, so a lot of people depend just on Social Security. And on my website, I've got on mygovexpert.com, I've got a section where those 40%, so we're talking tens of millions of people in America that are just living on Social Security and maybe some other little side gigs. I guess like the Commissioner of Social Security has a side gig as well. I think he's going to get paid a lot more than, $10 an hour or whatever the case may be. But there's a lot of people that are just struggling with just Social Security. So you can check it on my website, mygovexpert.com, and I've got a bunch of other resources down there: Medicaid, Medicare Savings Program, the extra help with prescription drugs, Section 8 housing, and all kinds of different extra help. And we're coming up with some more help as well. Some people said they're having issues with the audio. Some people are not. So sometimes when that happens, if you just redo YouTube, then it seems to work fine. So maybe that's it.
All worked pretty well.
This is live.
Social Security became America's biggest government program. Today, it pays $1.6 trillion in retirement, disability, and survivor benefits to 73 million Americans. But when World War II ended, there was a shock to the system.
Post-war America, with a building boom and a baby boom.
And all those baby boomer babies got older. Now, there are a lot more people getting money from the system and a lot fewer people paying in. And we started living longer. In FDR's day, the average age of death in America was 63 years old. Today, it's 77. That's 14 years more payments per person.
You will hear a lot of people saying there will be no Social Security for you. And that's, in all likelihood, not true. So if Congress does nothing, they'll get about 80% of what they get now. And that will be a significant hit for a lot of Americans.
Okay, so we've talked about, my regular viewers know about this. Maybe there's a bad sound with the video that I'm showing. So I'll just go ahead and we'll go back to our regularly scheduled video here. Okay, so what he's basically talking about is, regular viewers of my channel know about this. The Social Security Trust Fund is not running out. Well, it is running out, but it's running out. It was saved for the baby boomers. The baby boomers put that money away, and now they're getting older. If you're lucky, you get older, and then you get that money out. So, but the trust fund, the problem is, regular viewers to my channel know that it's not necessarily about people living longer or the baby boomers, that there's more baby boomers. It's the fact that the money that if we continue to get, since the 1980s, if we continue to get wage increases, like our productivity has increased considerably, if we would have also gotten wage increases, then Social Security would have been good for another 75 years. But the problem is, a lot of that money has gone to the top, and those people at the top, if you make over $176,100, then you no longer pay into Social Security after that amount. You only pay in under. So if you're making $50,000 a year, you're paying 6.2% of your income into Social Security, and then obviously your employer pays the other 6.2%, unless you're self-employed where you pay both. But if you're making $500,000 a year, you're only paying into it for the first $176,100. And the problem is, the wages that we would have normally got because of our increase of productivity hasn't been coming to us. It's been going to the higher wage earners, and therefore it's outside of Social Security. And that's the issue going forward. And pretty much no politicians over the last 40 years. So someone in the, before we started today, someone said, I didn't know you were anti-Trump. No, I'm pro-Social Security. President Trump didn't do anything in the first 4 years to save Social Security, didn't really have a plan, doesn't have a plan this time. I give him some credit. He said he's not going to raise the retirement age. They tried to do that earlier this year, change the retirement age to like 69 or 70. But because President Trump, said, I'm definitely not going to change the retirement age, that was pretty much quelled. So that's good. But there are other places that they're the issue. And the very fact that putting the Social Security Commissioner, making this his side gig now, just shows the American people that the current administration doesn't really care about Social Security, that just not part of the situation. So people are still having a little bit of problems with the volume, but other people are not. So just go ahead, restart YouTube, and that usually works. Okay, let's get into some questions here. Let's see, sound is working. Yeah, someone is going in there and yeah, harassing our volume. Those the people, possibly that might be it. The people that don't want people to see what's going on here. Anyway, so not sure if that's truth. I don't want to be a conspiracy theorist, but yeah, someone threw that out there. But anyway, okay. Would you recommend I go into the Social Security office, having an appointment to make an application for Social Security early, or just do the application online? Either way is fine. Social Security is really pushing online services. They have been for a while, and it's online services are fine. But the problem is if all you have is a hammer, everything looks like a nail, right? So if you go on to Social Security and you want to file for retirement benefits, then 100% that's what you need to do, and your CEQA, your earnings record is correct, everything is good. Then if you go in the online and file, that's fine. A Social Security employee, if there is one out there able to look at your claim, still has to check it and see if there's any gap years, see if there's any scrambled earnings, see if there's any ex-spouses or spouses that are eligible for any type of benefits or anything. So there's a lot of things that have to be done. But yeah, an application online, if you know that, yes, you just want to file for retirement benefits, the Medicare is not an issue that you need to address right now. You're not eligible for any other benefits. Maybe you should file for retirement benefits and disability benefits at the same time. Maybe you should file for survivor benefits rather than retirement benefits, or retirement benefits will hold off on survivor benefits. So there's a lot of different variables. And Social Security basically, they're pushing for people, just go online and, let the chips fall where they may. If you're 100% sure that's the only thing you're eligible for, then yes, just make sure your earnings record is correct, because that's how they're going to determine how much benefits you make for the rest of your life, is how much your record shows. So that's a very, very important thing. But if you have some questions, it's always good to schedule an appointment and actually talk to a human being. So there's that. Carrie, in my small community, those who rely on food banks are almost out of this option. Yes, a lot of food banks throughout the country, unfortunately, are closing down. And that's one of the things that our new platform, our new website, our new community is going to do, is help people with food stamps and also find access to food banks. That's one of the major focuses of our coming project that is very, very close to completion. I've been saying this forever, but I keep adding stuff, and my computer programmer says, come on, we need to make this live. And I know that, but we need to add this too. So, Scott, require AI worker robots to pay into Social Security. Yeah, I mean, that is the problem with Social Security right now, is the trust fund. Or for those new people, for new people that have don't know about this, we get revenues every year going into Social Security. This is 2024, about $1.2 trillion comes into Social Security. 1.1 of that comes in from people working. But when people get fired, laid off, replaced by AI or robots or something like that, where does that money go that they used to hire somebody? Well, it goes to the board of directors and shareholders and stuff like that. And those people already make quite a bit over $176,100. So what those workers who were working would have paid into Social Security, now they're replaced by AI and robots, and they don't pay into it. And the people that get that money now don't pay into it. So that is the issue. It's not necessarily the baby boomers, the fact that, 76 million people were born between 1946 and 1964. It's not necessarily that. It's the fact that those people have had flat wages for decades. That's the issue. So, billionaires need to pay their fair share of taxes and support the elderly who worked. Yes. And people say, well, the top 10% or something, they pay, 60, 70% of the taxes. And that is I'm not sure about those particular statistics, but yes, the top 10, 20% pay a majority of the taxes. And they say, but they already pay a majority of the taxes. And then, but that shouldn't stop your, people's question. They'll say, yeah, that's right. Isn't that terrible? That they have all the money, that they're making all the money, and therefore they're paying all the taxes. If we had some of that money, if, we were, paid for our productivity, then we would be paying higher taxes. I'm sure everybody in here would have no problem paying more into Social Security and more into taxes if they were just making more. But the problem is so many people are just struggling to get by. They don't pay taxes. That is a fact. So my husband is legally blind due to diabetic neuropathy, glaucoma, and stroke in his left eye. He is already receiving Social Security in 72. Is there a benefit for blindness? Unfortunately, no. Once you're past your full retirement age, then there's no more disability. Everybody that is on disability, once they hit their full retirement age, their disability switches to regular retirement. So nobody after their full retirement age, 65, 66, 67, or whatever the case may be, nobody is receiving disability benefits after their full retirement age, unfortunately. But remember, there is other benefits, not from Social Security, but if you're having a hard time paying for your Part B premium, and you're low income, low resources, since you're married, it's going to go with a household. But if you're low income, low resources, you can apply for Medicaid for him from the state. And if they approve him at the upper levels of Medicaid, they will pay for his Part B premium, the $185. It's called the Medicare Savings Program. So definitely check that out. And then there's also the extra help with prescription drugs. You apply through the Social Security Administration for that one. That is a super easy, application to do. Why is Trump targeted? He's the current president of the United States. You had Obama for 8 years and Biden for 4 years, so 12 years of Dems, and they did nothing. I agree. Your anti-Trump rhetoric is disgusting. I'm anti-everybody that didn't do any. Again, I'm pro-Social Security. I've complained about Biden, the Social Security Fairness Act. I said it wasn't fair. It was a stupid act. Was the previous situation good? No, it was unfair. But then they decided then Biden, and it was supported by Trump and both sides. So I have to be fair there. But yeah, it wasn't fair and it's terrible. So Obama didn't do anything. I agree. Biden didn't do anything. Trump didn't do anything under the first 4 years. He's not doing anything now. He's actually doing negative by making this a part-time job. So again, that's why I showed the 40 years of failure. So yes, nothing has been done to shore up Social Security since the early 1980s. Nothing from all politicians. So there's that. Let's see. Politicians are a lot like me in college. Don't do homework to the night before and go ahead and bat out of hell. Yes. And that's one of the in that story that we possibly were having audio difficulties on, is Michael Estrue, the former Social Security Commissioner. And by the way, he said he's a Republican. He's always been a Republican. He voted for Trump. So he says Trump is lying about Social Security and all that, getting, people that are undocumented getting Social Security benefits. But he argued that he says what will happen is in this 40 years of failure, they will, kick the can down the road for 40 years. And then he says what will happen is they will be in kind of a shock campaign just before the benefits are to be cut by 23%, and then they will do something. And I disagree with him there. I forget exactly the exact word he said, but it's kind of a shock type thing that they will be, put back on their heels that, oh my gosh, we actually have to do something. No, I disagree. I would argue that was their intention all along. One particular party, you can look in my description, and I have the playbook that they wrote in the 1980s, and this is going exactly as the playbook dictated. They will do nothing, kick the can down the road for years and years and years and years and years. And at the last minute, when the American people are about to get that cut of 23%, then they will say, hey, we tried nothing and we're all out of ideas. I guess we just have to give it to Wall Street. And that was the intention the entire time. The other side of the political party had some plans not privatize it, but to increase, to raise the cap on FICA. Biden had that plan, Harris had that plan, to raise the cap so the percentage of how much people paying into Social Security would be fair across the board. But they were inefficient, incompetent, unable to do anything. So 40 years of planned destruction and incompetent destruction. So yeah, and the proof is in the pudding. Is it fixed? Are we not going to get 23% cuts? No, it's in the works right now, and nothing has been done to change it. And it's even worse because, again, now the person in charge doesn't even care. If you haven't done it, yeah, please forget to hit the thumbs up button. Yes, please. So I pretty much have to work until 70 for full benefits. The 8% per year gets canceled out. Yeah, if nothing is done, that is a fact. And what Easy Eddie is talking about is the fact that when you wait till after your full retirement age, so if your full retirement age is 67 and you wait until 70, Social Security adds 8% onto your Social Security benefits every year you wait. So if you wait to collect your benefits at 70 and your full benefit amount was, let's say $1,000, then you will get $1,240, 24% added on there. So $1,240. And the cuts, as he mentions, Easy Eddie mentions, yeah, that cuts it out 23%. So that's why a lot of people are deciding. We had a really, really big push early this year, people filing for Social Security benefits, retirement benefits, because they saw kind of the writing on the wall. They saw, they said, hey, this is not good. Let me just go ahead and get my money while the getting's good. So there's a lot of people taking that early retirement when they actually planned to work longer and delay. So, but remember, there are some of those people that took benefits because they were scared of this, that, or the other, and never do anything like that out of fear. You can change your mind. There's a few ways. So those people out there that started their benefits early that said, oh, I shouldn't have done that. No problem. Here's a mulligan. Within 12 months, you can change your mind. You just contact Social Security and say, I want to withdraw my claim. It has to be within 12 months. So you say, I want to withdraw my claim, and they withdraw it. But because you're withdrawing it, it's like it never happened, like you never filed. So if you received any money in the last 3, 4, 5, 12 months, or whatever the case may be, you have to return that money. No interest, but you just return the money, and it's like it never happened. And then you can file for retirement benefits again the next day, or next year, or 2 years ago, or whatever the case may be. So that is a way to kind of, fix if you don't think you should have done it the first time. And there's working as well. If you find a job and you're under your full retirement age, you just contact Social Security and they can withhold your benefits. If you go over $23,400, you just call Social Security and say, hey, I'm going to be making $20,000 over that. So they'll withhold $10,000 worth of benefits. If you receive $2,000 a month, they'll withhold 5 months and then release the 6 month, 7 month, 8 month, 10 month. They will recalculate. They'll add those months back into your check once you hit your full retirement age. They won't give you the full check. They'll just unreduce your early retirement. So I live in a rural small town in Texas. So did I, Paris, Texas. And very little Medicare Advantage plans available out here in the woods. Only highly populated cities get the best Medicare plans, I guess. Yeah, it's all about competition. And yes, in the smaller places throughout the country, there's not a lot of a lot of opportunities, a lot of different competition for different Medicare plans. So yeah, it's unfortunate. So you just have to, pick the best one available. And remember, it doesn't matter who you call. The important thing is to be prepared. And what I call it the 6 P's of picking the best plan for you. Have your current plan. That way you can see maybe your current plan is still the best for next year, but at least you're comparing apples and oranges, apples and apples, I guess. And then you have your providers, which one doctors or hospitals you definitely want to keep. You have your prescriptions available there because you want to make sure your prescriptions are covered at the cheapest price. If you have a particular pharmacy, make sure you know the name and the address of that pharmacy. Whatever priorities you have, you need more dental, need more vision, want to save as much on hospitalization or whatever the case may be. And in this case, have a little bit of patience. If you call Chapter, if you decide to call Chapter and they support this channel, and the websites and all that stuff, so makes all this free for y'all. So if you call Chapter, they can talk to you now and check out your plan and everything and see if there's a better plan out there. But nobody can actually change your plan until start of October 15th. But you have from October 15th to December 7th to actually, make the switch. And then your new plan won't be available until January 1st. So, but if you have a Medicare supplement plan, you can change that pretty much any time of the year. You can go from a G to another cheaper G, or an N to a cheaper N, or whatever the case may be, depending on your state and your health. I'm going to change this P here, this last P. I think I'm going to change it to persistence, because finding your plan is just the first step. So this plan, your Medicare Advantage plan, lasts you for 365 days. It'll take you about an hour to pick it, but then you've got 365 days to make sure you get everything that you're paying for it. So I'm going to change that last P to persistence. You have to stay persistent. And that's one of the reasons my son and I partnered up with Chapter, is because they have a team that helps you fight prior authorizations, that help you find a doctor, that make sure you're getting everything you possibly can from what you paid into it. So if you want to give them a call, definitely give them a call. Their help is 100% free. Kim's Farm Adventures. Wow, that's interesting. My husband turned 65 in a few weeks. Does he need to file for Medicare? He has good insurance with a job. It depends if his employer, that plan, has 20 or more employees. If he is currently working, has current insurance from his current work, and that plan has 20 or more employees, then nope, doesn't have to sign up for Medicare. If he's already receiving Social Security benefits, he's not receiving Social Security benefits because he's turning 65 in a few weeks. And if he was, he would have already received his Medicare card, unless it was lost in the mail or something. So he's probably not receiving Social Security benefits. So he doesn't need to do anything. And he doesn't need to contact Social Security and say, I don't want it, because he's not receiving benefits and he wasn't automatically signed up. So yeah, as long as he has health insurance from current work, 20 more employees, and he's happy with it, that's also very important. Sometimes people sign up for Medicare Part A alone because it's, after all, zero premium, and might save some money on hospitalization next year if he happens to go to the hospital or something, because the co-insurance, the deductible, sometimes is cheaper under Medicare Part A. So some people do that, just sign up for Part A, get a little bit of extra insurance there, zero premium, because you already, he paid for it all those decades he worked and paid into FICA. It's already paid for it. Might as well get it, right? But definitely don't get Part B. Don't waste the $185. And then once he stops working and stops receiving health insurance from that work, or your work, if he receives it from your work, then sign up for Medicare Part B at that time. Next year, 3 years from now, 5 years, or 10 years from now. And there's no penalty whatsoever. You just need to prove that he had health insurance since he turned 65. And that's easy. On my website, I've got the forms that you need. By the way, this is what I was talking about, living on Social Security alone. I've got it on my website there. It has all of the different things for those people out there struggling. Some other programs. Unfortunately, a lot of these programs are being cut based on the big beautiful for billionaires bill. So for Medicare, the enrollment periods, you just need a couple of forms, and the forms are the CMS 40B and the CMS 564. One of these is to actually start the Part B, and the other one is a form that you need to have his employer fill out that shows, yes, he had health insurance, and since he turned 65, don't penalize him 10% for every 12 months. And so easy, 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 easy. So you can go onto my website and find that, mygovexpert.com, or go onto ssa.gov or medicare.gov or whichever one. So let's see here. Hi, how do contact to get help to pay for my Medicare $185 monthly in California? Okay, good one. Yeah, that would be Medicaid in California. In California, they call it Medi-Cal with the, yeah, anyway. Yeah, you call Medi-Cal in California, and you tell them you want to apply for Medi-Cal, Medicaid, and they'll do the application and everything. Again, low income, low resources, and if you're approved at the higher levels, there's different levels of Medicaid, QMB, Slim B, QI, and stuff. So if they get you at those higher levels, then they will pay your $185. So it's a beautiful thing. There's so many people. It's estimated that only about half of the people that are eligible for that get it. So please, everybody, press like, subscribe, share, tell your friends about that. You might tell somebody that, and you're like, oh yeah, that guy makes a lot of money. But maybe you tell them that, but they have a sister or brother, aunt or an uncle that could really use that information. So it's, we really need to share as much information out there as possible. And then there's another way as well. So if you're not eligible for the Medicaid, there is what's called a Medicare Advantage Part B give back, where certain Medicare Advantage plans, I always recommend Medicare supplement plans first, but if, that costs money, so a lot of people aren't able to get those. But Medicare Advantage Part B give back, and it's a Medicare Advantage plan that, as the name implies, pays for part of your Part B, $50, $100, $185, whatever the case may be. So you can reach out to Chapter there, reach out to Chapter and see if there's one of those available in your particular area. I retired at 62. If I go back to work, will I earn credits? If so, will it increase my check at the full retirement age? Both. Yeah. So those are two different things. So you're talking about quarters of coverage, the 40 quarters of coverage you need to be eligible for retirement, period. But sounds like you're probably already, you already got you paid your 10 years, you already got your 40 quarters, sounds like. But will it increase your Social Security check? Yes, absolutely. If you're 62 years old, 72 years old, 82 years old, 92 years old, even if you're already receiving Social Security, if you continue to work and continue to pay FICA into Social Security, then if that's one of your high 35 years of earnings, then yes, it will increase your Social Security benefit. So what they do is they look at it every year. So you work this year, and then next year, January, February, March, Social Security gets the notification that you made more this year than, this is one of your high 35 years, and they will automatically do the computation. It's not as quick as COLA. COLA, we should get, usually the COLA comes out within the next couple of days, but because the government shutdown and the fact that the Bureau of Labor Statistics, it's a nightmare. But anyway, COLA the announcement might be a little bit later than normal, but COLA won't take effect until January, and it'll take effect in January. We're just, not sure how much it's going to be. So let me see here. Random life things. Heard from Chapter today. Diana was very helpful in assisting me to figure out what my options are. Company seems like a good plan with a supplement G, being a good fit for me. Still comparing with others. All right, perfect. Yeah. So a Medicare supplement G is a Medicare supplement G. It doesn't matter what company it is. The only difference is price. The price now and the price going forward. And Chapter does a great thing. They tell you they've got a long analysis of the monthly premium for these companies, because sometimes you've got some local Medicare supplement plan that's, run by the, Northeast Texas Firefighters Union Medicare supplement plan. And so they're trying to get people to join them. So they, lowball the introductory price. And you're like, oh, wow, this is like half the price of everybody else. But then next year or the year after, then they jack up your prices and you end up paying more. So it's good to not only pick your plan based on how much it is now, but also, ask whoever and says, okay, I mean, what are these guys in terms of raising prices over, many years? And they'll give you an idea. So yeah, but a plan G is a plan G is a plan G. So you'll need a plan, and don't forget Part D, the prescription drug plan. You're also going to need one of those as well. So Scott, I heard, and thank you for letting me know Chapter's helping you out. I appreciate it. And remember, once you sign up with Chapter, that's a great thing. A lot of other places out there don't do very well, actually don't do it all sometimes, a lot of times, is they have experts that help you use that throughout the year. But in your case, if you have a Medicare supplement plan, actually you don't really need that customer service, because whatever the doctor says, if the doctor says you need X, Y, and Z and it's medically necessary, that's it. You never have to deal with that Medicare supplement plan. If Medicare pays for it, they pay their 80%. And then if Medicare pays for it, the Medicare's computer system talks to your Medicare supplement plan and says, hey, we paid our 80%, cough up the other 20, and they pay it. So once you pick a Medicare supplement plan, you don't really never ever need to talk to them again, except for there's a billing issue for your monthly premium, because unlike that's what Medicare Advantage plans, then you're gonna, is this covered? Do I have to get prior authorization? Which doctor do I have to go to? And yeah, so it takes a lot more persistence. That's the new word. So, Alan, what's up, Alan? For example, my uncle drove a bread truck in the 1950s, and he owned his own home and had a new Buick. In 2025, a guy could not support a family or contribute enough through FICA. Yeah, that's the issue right there. The baby boomers and those millions and millions of people born after World War II, that's definitely an issue that's affecting Social Security. But the most important thing is the fact that we just aren't making the money. It's going to the top, and they don't pay Social Security like we do. So, don't want any of his numbers released. Okay. Oh, you're talking about, the BLS. Yeah, it's never, the Bureau of Labor Statistics in terms of COLA hasn't been political since the early 1970s. They took that out of the political realm in the early 1970s. And unfortunately now it's back again. So the best things in life are free. I think there's a song, that's right. But you can save them for the birds. And okay, now give me money. What's what I want? Okay, yes. And you went right into the song. He couldn't be bothered by the American citizens. Yeah. This is unprecedented. The fact that now, Social Security is just a side job, because, his big focus is going to be the IRS, doing audits or possibly stopping audits of, people well connected. I don't know what we're doing here. Do you know about Kaiser? Chapter said it was free in hospitals. What about Medicare Advantage, A and B, Medicare, and different? Kaiser and C covers hospital. Do you need energy? Yeah, Kaiser is kind of interesting. They're the ones that started. Kaiser was, them and Blue Cross Blue Shield were one of the things that started whole health insurance. Kaiser was on the West Coast, and those are the guys that built a lot of the battleships and the destroyers for World War II, the shipbuilding, and their dock workers, they started health insurance. And so Kaiser, is big in American history for health insurance. And now there's the Kaiser Family Foundation. So if you hear me talking about statistics and stuff like that, it usually comes from the Kaiser Family Foundation, because it's so instrumental, and they really are focusing on healthcare and health insurance and everything. So, but they're unique. They don't have, they have captured agents. That means you can only sign up through Kaiser from these particular agents, Kaiser agents and stuff, but Chapter can definitely help you out. But yeah, Kaiser is kind of an interesting, unique one. I don't know if they have an N or a G. I don't know if they have Medicare supplements. I know they have Medicare Advantage. I'm not sure whether they have Medicare, and they have their own hospitals and networks and stuff like that. So, is it true? They said because I'm 65 and have potential retirement, I can't get SSI help. Is this true? Yeah, if you're eligible for any other benefits, retirement benefits, survivor benefits, spouse benefits, and those benefits are over $967, then that's over the SSI limit, because the max you can get for SSI is $967. So someone that is receiving SSI at the max, $967, if they turn 62 years old and now they are eligible for retirement benefits and those retirement benefits are $1,000, then their SSI stops because they're getting $1,000. So yes, that is true. Let's see here. Did you, time travel, what's up, time travel? Did you hear the ACA might be 380% in some states if Congress doesn't act? Yes. Yeah, there was Texas triple digits percentage increase, South Carolina, the Dakotas, Mississippi. There's a bunch of states out there that average, 200 or 300% increase. And again, they're using the abracadabra, fraud, waste, abuse, illegal immigrants. And that's the reason nobody's doing anything is because they said, oh, we don't, even though people that are not in this country legally can't get the Affordable Care Act. They can't get Medicaid. They can't get Medicare, period, end of story. So my husband died in 2021 while on Social Security disability. His full retirement age, his FRA amount was 62. I'm 63. Would I get his FRA or reduced to my age? It would be reduced to your age. So you would get, if you started at 62, you would get a reduced amount. But it's survivor benefits. So remember, okay, so here's what a lot of people miss. And here's one of the things that, if you file online, again, if you know 100% for sure what you want and it's correct and you've really, really done your research and you've checked out all the options, filing online is not a problem, But for, in this particular case, remember, you have the opportunity to either get survivor benefits or file for benefits on your own record. And you can choose. In this particular case, you can choose. So here's what I would do. You call Social Security and, the work limitations are still there. You have to stay under $23,400. Anything over that, they're going to hold back $1 for every $2 you go over. Whether you receive retirement benefits or survivor benefits, the limitation is still the same, okay? But let's say you want to go ahead and file for survivor benefits and you get that, even though it's reduced, and you don't touch your benefits on your own record. And your benefits on your own record will continue to increase until you turn 70 years old. So maybe you file for survivor benefits and you get that until you turn 70 or 67 or 66, and then you switch to retirement benefits on your own record, okay? Or maybe it's a better idea to go ahead and file for retirement benefits on your record and then get survivor benefits, file for survivor benefits at your full retirement age. So either one of those, it really depends on what we're looking at in your particular situation. So I would call up and, check out both of those options. I wouldn't do it online because you want to check out which one is best. Start your survivor benefits now or your retirement benefits. Someone's asking on another platform, what exactly is Chapter? That is the company we've partnered with that help people find Medicare Advantage plan, Medicare supplement plans. And so you can give them a call. For the other platform there, you can look in my bio and you click on there and it'll give you the phone number to call to evaluate your plan. So let's see here. I called Chapter, but I forgot to get the guy's name. He's supposed to get back in touch with me. This is going on a little over. Yeah. Just call. They will have, as soon as you call them up, tell them your name or your phone number, they'll have it, and they will put you right in touch with the person you talked to before. So yeah, just give them a call and say, hey, I talked to someone. Oh yeah, you talked to Brenda or whoever, Mike or whoever. So they'll know exactly who you talked to before, because it'll be they'll have a record of that. And remember, you can't actually make the change until October 15th. So definitely give them a call, and if you've got any other questions. Luckily, are the families, they can live together. It's going to be necessary, like, or not for a lot of folks. Yeah, that's the community, particularly the community that we have here. Y'all are helping each other out all the time. So you guys are awesome. So our second family, our third family, fourth family. I just called the Social Security 800 number. They answered in less than 10 minutes. And I made an appointment for October 22nd at my local office. Awesome. Good deal. October 22nd. So your local office is not that busy, it sounds like. So good. You had a perfect opportunity. Good, good, good. So sometimes it does work. People say, well, I just called and it, only 10 minutes, and that proves that Ed's wrong and everything else. And I'm like, well, Brad Pitt has a beautiful head of hair, and that proves there's no such thing as male pattern balding. So yeah, logic doesn't work there, right? So, but yeah, sometimes it's a hit and miss. So maybe you should go try the lottery later today and see if you get the same luck there. I'm late. Have questions. If anyone knows what counts as income when applying for extra help. Does Social Security retirement? They'll take that into consideration. Or survivor benefits? Yes. Yeah, any type of benefits like that. So we're talking about the extra help for prescription drugs. Call, apply. That is one of the easiest applications of Social Security. It's called it goes by two names: extra help with your Medicare prescription drugs, big long name, or LIS, the low income subsidy, it's called. So, and the thresholds change a little bit every year. So I would apply. So just apply, and you never know. And anytime you apply for something like that, any type of extra help, be it that one or Medicaid or food stamps, or doesn't matter, SSI or whatever it is, and ask them, says, okay, I applied this year and I guess I'm over. And they say, oh yeah, you make too much. And you say, okay, how much over? And it says, oh, you made $1,000 over. Oh, okay, then, okay, that means probably not going to be eligible next year. But if they say, oh, you're just $10 over, that means when the new numbers come out for 2026, maybe that $10 is not an issue anymore, because of the thresholds and everything. So if you're close, always ask. Anytime you're denied for something like that, ask. I mean, how close was I? And I say, oh, you're this. And, evaluate exceptions, because sometimes it's like, okay, resources, do they count burial insurance? Do they count whole life insurance, this type, and all this kind of stuff. So sometimes they can exclude particular parts. So if you need help, persistence, that's the new word, just fight for it. And that's one of the things our new platform is going to do, our new community is going to do, is help people get the benefits they need out there. I have paid all of my overpayment back to Social Security. I will be full retirement age January 2026. My question is the overpayment that was paid, will I get that money back in January? So not exactly sure. Okay, so full retirement age. So you had an overpayment because you were paid too much based on early retirement or disability, or yeah. So maybe trying to figure out where the overpayment came from and see how that affects your full retirement age. I'm figuring, based on doing this a million times, what you're talking about is that you filed for retirement benefits early and then you made too much money. So you had to pay that money back. And they basically suspended your checks, or you had to pay that money back because it happened after the fact, or whatever the case may be. So if that is the case, you won't get that money back, but your benefits will be recalculated. So here's how it works. So if you took your Social Security benefits 30 months early, then you're reduced by 30 months. But let's say after 10 months, you go back to work and your benefits stop because you're making way over their, the annual earnings limit. So for the next 20 months, you don't get a check. So you only got 10 checks. Once you hit your full retirement age, they're not going to, keep reducing your benefit by 30 months because you didn't take 30 months. You only took 10. So they will recalculate. It's called ARF, Adjusted Reduction Factor. So that is automatic. When you restart your benefits at your full retirement age, the computer system automatically goes in there and says, oh, Brunetta is reduced for 30 months, but that's not correct. She should only be reduced for 10 months. So they redo it, and then you're just reduced for 10 months. You don't get those 20 checks back. You just get unreduced. So, Gracie Allen, thank you. No supplement through Kaiser. Yeah, I thought that was a fact, but I didn't know if they added anything recently. Yeah, I think they're just Medicare Advantage and regular, health insurance and stuff like that. So, thank you for that. I didn't want to be incorrect, but I was almost 99% sure. So, thank you for that. Let's see. Thank you again for sharing your positive information on health. The government, much grateful. Thank you. And Spitfire Red, thank you for sharing that information and helping those around you, because that's what we're all about here. So, age 70, got first check this month. Will they also be paying my Medicare premium? Yeah, if you signed up, if you've been paying your Medicare premium yourself, like, monthly or the quarterly thingy, yeah, once you actually start your Social Security benefits, so it sounds like you delayed until 70 so you can get the max. So you got the 24% or so extra. Yeah, they'll take it out of your check. But be careful. Usually there's a delay there because we're talking two different computer systems, Social Security and Medicare and stuff. So if you already paid for Medicare for, let's say, this month and next month, and then they start taking out of your Social Security check, sometimes they'll take it out again. So you'll get the 185 taken out twice. But as soon as one computer system talks to the other computer system, they will notice that you paid twice for 1 month, and you'll have a credit on your account for that $185 or 2 months of $185. So that's automatic. They'll refund that money. So if that happens, just give it about a month, and you should get a letter that said, yeah, you got a credit, and they credit it back to you. So, yeah. I wonder how much of an increase we'll get next year for Social Security payments. Yeah. Don't know. One time I had a conversation with a robot. It took me a while to realize it wasn't a real person. Embarrassing. Yeah. Let's see what else we have here. Why are Social Security checks so small? All right. I'm gonna answer this figuratively. They're about that size, but they don't exist anymore. They don't give out Social Security checks anymore as of September 30th, unless there's an exception, super small exceptions. But yeah, I know what you mean by small. Yeah, the average check's about $1,900, and people said, "Wow, I wish I was average." Yeah, it's all based on how much you paid into Social Security over those 35 years, and then they do a calculation. So they take your averaged indexed monthly earnings. It's called the AMI. And so they take that high 35 years, index it for essentially today's money, and then they divide it or multiply it by these three what's called bin points. And yeah, for a lot of people, it's just way too small. So, don't worry, you're just too awesome. Oh, thank you. I appreciate it. And you are just too awesome for sharing all the information with other people out there and helping people. So, 68 now. I was married for 13 years, now divorced. Can I apply for half of my ex's now? He's 67, even though mine is more, and then wait? No. And then wait until I turn 70 to get my full for waiting? No. The only time you can do that is if we're talking about surviving spouse benefits. But yeah, because it was a divorce situation, sounds like he is still out there somewhere. So no, you have to file for benefits on your own record first, and then you file for spouse benefits, and his benefit amount has to be twice your full benefit amount. So that law changed in 2016. But if it's a surviving spouse, yes, you can switch one or the other. And someone, before we started our Q&A today, someone was saying that she is waiting to file for divorce spouse benefits until she gets enough, gets over the fear. I guess she was in a terrible situation with this gentleman, and she's hesitant to get money from his record because of that situation. And let me tell you that Social Security, it doesn't matter. It's not going to affect he won't know that you are collecting benefits from his record. It doesn't affect his benefit amount. If he's remarried, it doesn't affect his new spouse or new kids or anything like that. It doesn't affect that benefit at all. It's completely 100% to if you, I guess sounds like if you tolerated that person for at least 10 years, you are entitled to benefits on that person's record. Again, you have to file for benefits on your own record. And if your full benefit amount is less than half of his, then you file for spouse benefits. And the only thing you'll need is a marriage certificate and a divorce decree to prove that 10 years marriage, for at least a 10-year marriage. And that's it. And so you don't need to be fearful of anything he won't even know. So it's none of his business. It's your benefits. So my husband and I are 69. We get $1,600 per month. I worked from 16 to 65. Yeah. Both of you get $1,600 or each $1,600? Yeah. If it's both of you, $1,600. Wow. That's not good. So if that's all you're receiving, you make sure you reach out to all the other programs that you might be able to get some, help with, Medicaid, pay for your $185 for Medicare and all the rest of it. So yeah, please. Dr. Ed, I'm in South Carolina. I spoke with someone from the chapter. They recommended a Plan N healthcare. I'm not familiar with Medico. Are they good? Yeah, absolutely. Yeah, Medico is very good. And you Plan N. People ask me what I would choose once I turn 65. No, I'm not 85. If I'm still relatively healthy, and I've got the money to pay the monthly premium, then I would get a Medicare supplement Plan N. If I'm less healthy-ish, or if I think there might be an issue, I would get a Plan G. If I didn't have the money, then I would just get a Medicare Advantage and make sure I was persistent, right, and kept up on it. So yeah, Medico is a very good company. So I stubbed my toe, and I sure it was Trump's fault. Then I figured out it was actually climate change. Yeah, that's the same logic politicians are using right now. Everything is fraud, waste, and abuse, and illegal immigrants. It's my lack of hair was caused by illegal immigrants. For retirement age in December, can I get my Social Security and Medicare and continue to work? Yes, absolutely. Once you hit your full retirement age, you can work, collect your Social Security check, make $1 billion a month from work. Wish you could make for Social Security, but anyway, no issues whatsoever. But remember, if you're going to continue working and you have health insurance from current work, yours or your spouse's, you're going to sign up for Medicare Part A, and that's zero premium, covers the hospitals. But if you have health insurance from work, your employer has 20 more employees, and you're happy with your health insurance from work, then don't waste your money on the Medicare Part B. You can get that later. Once you stop working next year, 2 years, 5 years down the line, then you go ahead and get Part B. So if your ex-spouse has signed up for the Social Security benefits but isn't getting payments until January, can I go ahead and file for mine on his now as well? Have met all other criteria except for 2 years divorced not till March. Okay, so that's not relevant to you. The 2 years thing is for independently entitled divorced spouse benefits. That is, you're collecting benefits on your own record, but you also want to collect divorced spouse benefits. But in this particular case, he hasn't filed for benefits yet, but he's at least 62. So you have to be divorced 2 years. The final divorce has to be 2 years. But because he filed, the 2 years is not relevant. No relevance whatsoever. So yes, you're getting benefits on your own record, and then you just call and you say, yeah, I want to go ahead and file for spouse benefits too, and they will see that he has a claim pending, and they'll say, yep, okay, we can start the spouse benefits when he starts his in January. So yes, absolutely, go for it. So yeah, the 2 years is only for independently entitled divorce spouse benefits. It's not for everything else. So. Let's see. I was married 10 years to my ex-husband. He can't claim his SSI. Can I? SSI is the welfare-based program. Anybody that's disabled or over 65 can get SSI if they have low income, low resources. But I know you mean Social Security. So married 10 years, he can't claim his Social Security. Can I? Why can't he claim his? So he has to be eligible for benefits paid into it. So I'm not sure why he can't, because he's working. If he's working and he just wants to wait until later, that's where the independently entitled divorce spouse benefits. So if you've been divorced for 2 years and your benefit amount is less than half of his, he's at least 62 years old, then you can collect benefits on his. Yep. So hopefully that's the situation. How can I get a job if I receive SSI? Again, SSI is the welfare-based program. You can work. The money you make is traditionally offsets what you receive from SSI, but you can work. So let's see, what else we got there? You have to sign up for your own Social Security first, then you can file for his once you pass the 2-year mark. Again, only for independently entitled divorce spouse benefits. So let's see. We all get plugged into a work history math and then Social Security spits out our check amount. Yeah, that's pretty much it. Yeah, they look at the AMI, the average index monthly earnings, and then they multiply it by these bin points. The first bin point by 90%, the other one by 32%, the other 15%. And that's, how we save Social Security as well is we, in the cap, we add another bin point. So fourth bin point could be 0.00001% or something. So, and then Social Security is good for another 70 years. So, or the alternative is to pay us more money, and we'd be more than happy to pay more Social Security if we made more money. So, but they have decided to keep it for themselves up there and not give it to us. I am planning to retire in my 62nd, but I need to know, will they give me my full benefits when I turn 67? If you mean by retire, you're going to start your Social Security benefits at 62, then they're going to give you a reduced amount, 30%. And then then that's going to be your benefit forever. If you mean by retiring, you're just going to stop working and you're not going to collect Social Security. Yeah, once you hit your full retirement age, 67, you're going to get your full benefit amount. But if you file early, anytime you file early and it's reduced and you continue to receive those benefits, then it's always reduced. So, all right. I think we are way over an hour. I think we had a little bit of technical difficulties in the first part of it, but we got through it as always because you guys are awesome and I appreciate y'all. I'll be back again tomorrow. We'll talk about another topic and I'll answer a whole bunch of other questions. And if I didn't get your question today, make sure you join me back tomorrow and we'll do it all over again. All right, y'all take care. And please, 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 please take care of each other.